with that, we'll start today's session. Nutritional and food requirements of adolescents, according to the general theory, what we have, teenagers, males and females, they both require around 1,400 to 2,800, depending on their activity levels, okay, per day calories. Okay, this number varies as different based on their exercise pattern, what is their metabolism. Okay, males have, teenage boys have higher metabolism as compared to females. Okay, so based on all these criteria, usually the range is between 1,400 to 2,800 kilocalories per day. So nutritional and food requirement. So food guide, just like how you would serve an adult, but we have to focus a bit more on calcium as well as protein intake for teenagers. Okay, so a variety of fruits and vegetables, whole grain, legumes, beans, food which is rich in protein and iron, and calcium for females, protein and calcium for males. Okay, and plenty of water. So coming to the energy part, 2,700 to 3,020 kilocalories in the initial few years of teenage, because that's when you have the growth spurt. Okay, whenever the growth spurt is taking place, that's when you may require this high amount of calories. Otherwise, if the child is sedentary, okay, very sedentary lifestyle, and once they grow out of like when they grow older than 15 years old, 2,000 kilocalories per day, if it is maintained, that is also adequate. Okay, less than 2,000 kilocalories per day, that is also adequate. So energy, the caloric needs will continuously increase along with the growth and development that takes place during teen days. Okay, and because of the growth spurt, you have to supply that amount of energy as well via food. Okay, so growth spurt is the main focus here. We do not control this growth spurt in adolescence. Okay, it may take some children may have an early growth spurt, some may have a late growth spurt. So depending on that, I identify the signs of growth spurt and accordingly increase the calories. Boys may require 2,750 to 3,000 to 20 kilocalories. Okay, that is for boys. Girls, if it is if they are only athletic or active, only then we may require such amount of calories. Otherwise, it's not necessary. Within 2,000 kilocalories, you can cut down the calorie intake for females. Okay. Next, coming to protein, it should be more than 1 gram per kg body weight. For adults who are sedentary, we focus for at least 0.8 gram. But when you are a teenager and when you're dealing with teenagers, okay, protein intake should be at an average at least 1.5 or 1 gram, at least 1 gram per kg body weight. Okay. Now, fat intake, 35 to 50 gram per kg body weight fat can be used throughout the day. Okay, but not more than that. For women, it is for female teenagers, it is ideal to keep that range between 25 to 30. Okay, because fat metabolism is quite slow in females as compared to males. Coming to minerals, 1,000 gram of calcium is required, calcium and 1,000 gram of phosphorus. In your textbook, they have given 800 mg. Okay, but that is the old value. But nowadays it is 1,000 mg for women as well as for men. And iron, specifically for girls, you have to focus more on that. They may like on an average, they may lose around 0.5 mg of iron per day when they're menstruating. Only during that menstruation days they are losing iron, so that has to be replenished. Okay, and make sure you do at least yearly once or 6 monthly once. You have to get the hemoglobin checkup done. Okay, it is just like RPS. You can get an instant result of hemoglobin. So for girls, they should for boys, they should never go beyond 18 μg per kg. In the textbook, they have given 12, but for boys, it should not go beyond 13 μg per kg. Okay, usually in clinically we see the number 13 as a cutoff for adolescent boys. Okay, and for girls, they have mentioned in the textbook 8 μg per kg. Do not go beyond that. But clinically speaking, we do not allow the adolescent girls to go beyond 11 μg per kg deciliter of hemoglobin. Okay, so clinical practice and the nutritional practice is slightly different. Okay. Per kg body weight, per kg body weight per day. And the fats, we are including the essential fatty acids also along with that. Okay. It seems high because for fats, we are considering the recommended RDA for boys. So please keep in mind, for some boys, the highest calorie intake what we have given is 3020 kilocalories. Okay, so please keep that figure in mind. Okay, so we are not discussing for females. So that's why I have said earlier, when we're discussing about fats, for girls, it should be between 25 to 30. Don't go beyond that. But for other active athletic male teenagers, okay, we have given this number because we are keeping in mind the calories what the boys require. Okay, the calories required by the boys. Okay, so there is a gender differentiation here. So please keep that in mind. Okay. It is given for athletic boys. So please read that again. Next, coming to water, sorry, vitamins. Vitamins, if they are considering fruits, if they are, if the child is having, the teenagers are having fruits on a daily basis, salads on a daily basis, you don't have to worry about the vitamins. But if not, then even at least via juices, fruit juices, okay, the fruit juices which does not have sugar, which is not toned down with water, that kind of fruit juices should be provided, okay, to get the vitamins. And vitamin D, if it is a vegetarian, okay, you can check with your physician and go for vitamin D supplements as well. Okay, for non-vegetarians, you can give them eggs, milk, etc. Milk is highly recommended, okay, for teenagers up to the age of 18. If they indulge in dairy products, it is encouraged, okay, for vitamin D requirements. Water, usually adolescents will drink very less amount of water. Okay, so frequent consumption of like soda, snacks, that should be kept in mind, because instead of water, they may be going and consuming Pepsi, Coca-Cola, or something like that, carbonated drinks or sugary drinks. So that has to be avoided. You can't put a ban on that. Okay, you can't put a ban on that, but try to avoid it. Try to avoid giving kids a lot of money to spend on such junk foods. Okay. Yeah, both of them can take multivitamins. Like if only if the child is not indulging in, or they have issues with their diet, they're not following a proper nutritional diet, only then we recommend multivitamins. Okay, if the kids are having a proper diet and all, okay, they do not create much fuss regarding their diet, etc., no need to give multivitamins. Okay. And for vegetarians, if you are consuming milk and all, no need for vitamin D supplements. If you are vegan, if you're enforcing the child also to be vegan, obviously you have to go for vitamin 12 as well as vitamin D supplements. If they're having milk, no need to give vitamin D supplements. Okay, milk can adequately, even a glass of milk, 500 ml of milk per day, it can give them their calcium, vitamin D, as well as protein requirement, along with some other food. So recommended daily allowance, protein, energy, energy, you can see how different it is for males and females. For males, it could be much higher than this. We keep a 3000 kilocalories cutoff for males if they are athletic. Okay, so males, it could go much higher than this energy requirement. For females, it is much less. Okay, but depending upon their athleisure, okay, or if they are into gymnasium or any classical dance training, ballet, or any other sport activity, you have to amp up their calorie intake as well. So this is just a generalized view of protein, given by grams, calcium given by mg. Again, calcium they have given here 600. It is not true as of now. It is now 1000 mg. Okay, even the textbook they have followed the old ICMR recommendation, but the recent one they have changed it. It is 1000 mg. Calcium as well as phosphorus is 1000 mg. Iron also, you can see, take a screenshot of this. Okay, you can do the comparison later. But remember this, not every 10 to 12-year-old child may require protein which is equal to 54 gram. Okay, based on their body indexes, you may have to alter it. Okay, if the child has achieved a very high growth spurt by the age of 12, okay, sometimes a child may require 70 gram of protein as well. Okay, so it is very subjective. Okay, consider the child's height, weight, okay, lifestyle, etc. Every child is different. Every growth spurt is different, so consider that as well when you are recommending protein. So food requirements, usually we try to give them a balanced food as much as possible and avoid junk foods as much as possible in this young age, in this youth. We can't enforce good diet on them. It has to be a self-conscious choice that they make. Anything that you force or any food items that you ban, there are high chances that they may follow that particular route. Okay, they may go in that particular route. So putting too much of bans on certain foods is not an ideal way to deal with teenagers and their diet patterns. Okay. So coming to eating patterns, so like there are a high tendency for the adolescents to skip the meals. Okay, it could be because of body image issues also, especially in females. Okay, they want to look much more slimmer, trimmer, and much in shape. They may try to skip meals, and that's their ideal way of losing weight, etc. So you can see this pattern, this kind of eating pattern, most common in females as compared to males. Okay, and they have a tendency to enjoy meals outside their home. They do not enjoy home cooked meals much. Okay, frequent snacking. If they're hungry, they will go for some chips. Okay, something that is packaged or something that is sugary, rich in refined sugar. Then they will never go or reach out for fruits or vegetables. That is very common trait in adolescents. Okay, fad diets, or whenever they see a celebrity for following some keto diet, paleo diet, they will start making a fuss at their home that they also want to follow the same thing, not knowing the repercussions what this diet can have on their health. Okay, so these are the eating patterns that we commonly see in teenagers. Milk is not good only if you are lactose intolerant. Okay, if you do not have any issues with like issues related to lactose intolerance, I don't see any purpose in avoiding milk. Okay, if the child is lactose intolerant, then you can switch to other alternatives of milk. Otherwise, for especially in teenage, you can't like if you have issues with milk, if you think that it is causing some hormonal imbalances in your child, especially if it is a female child, go for buttermilk. Okay, or keep the child curd. Okay, that will not cause any lactose related issues to the child, as well as hormonal imbalances will also be not as effective as how milk could do such alterations. Okay, so for hormones and all, you have to see from where you are sourcing your milk. Okay, not all the brands of milk are using a hormonal induced lactating cows or buffaloes for dairy reasons. Okay, you have to see who are your vendors, what are the ethics of your vendors. It is a very tricky thing, but then you have to choose your child's health over such issues. Mostly, we do not have enough resources Okay, we do not have any other alternative sources which is as efficient as milk, okay, as easily uh, viable as milk. Okay, if it is some vegan milk also, it comes with a cost, comes with the maintenance issues. Okay, so that would be the reason why in Indian cuisine there is no replacement to milk. Okay, in vegan cuisine yes, but again when it comes to Indian cuisine, the like if a normal Indian household, if you ask them to completely replace milk with something else, they find it hard. It's a cultural, yeah, even most especially in Hindu families and all, using milk for various religious as well as food related purposes. It's a very cultural thing. So you can't substitute milk with something else. That is also something you have to keep in mind. Okay. Both soya milk or and dairy milk both are good, but it depends on are you lactose intolerant or not. Okay, milk that is obtained by ethical dairy, dairy husbandry, etc., that is fine. Okay, if it is if you are not inducing any hormonal induced lactation into the cattles, okay, and then if you are getting milk, that is not an issue. For protein, both are good. For protein, both are good. So teach them the benefits of home cooked food. Okay. Also, not just giving them the home cooked food. Make sure when you have a meal time. Okay, if it is lunch or dinner or breakfast, at least one meal a day. Make sure the entire family enjoys together, sits together. So it makes sure that the child has a better communication system with the parents also. Okay, a lot of mental health issues can be tackled just by doing these small gestures, just by having a family together, sitting on the dining table or in the dining room or on the floor, everyone sitting together and having a meal, chatting about their days. Okay, while growing up, these small things are what that matters, which will avoid your child feeling that isolation, okay, and going into some mental health disorders, okay, or eating disorders as well. Then dietary guidelines, well balanced nutritious food has to be given, enough calcium and protein rich food has to be given. No meal of the day should be missed by the adolescents. There are high intensity of children to miss the breakfast because they may be getting late for the school. Okay, or maybe because of body image related issues, etc. They may skip some meals. No meal should be skipped by the teenagers. Junk food limitations, we can't put a complete ban. Junk food is so accessible these days. Okay, even by sitting at your home using food delivery apps, you can get whatever you want at home. So put some monetary restrictions on your child, on the teenagers. Okay, that could prevent too indulgence in too much of junk food. Or you can keep a quota that only once a month we will buy pizza, only once a month we may make buy pasta. Only once a month we will eat cake outside, something like that. Keep a quota like that, and make sure that the child also follows that particular quota system. Okay. Next, coming to the nutritional issues which we see, obesity. It is most commonly seen that the teenagers who are from a better socioeconomic background, they have the higher risk of being obese. Also, children who come from a higher GDP states. Okay, for example, states like Maharashtra, South Indian states, okay, Punjab, etc. They also have a high chance of being obese as compared to other low GDP states. Okay, this is a generalized study that has been performed. Obesity among adolescents is much more common in southern parts of the country, in South Indian states, as compared to North Indian states. Okay, it basically, if we just see look at it in a fine way, it is all the states that has a higher GDP. Okay, those states have a high risk of their entire population falling under the obese category. Yet, lactose intolerance child can have soya milk for protein requirement. Okay. If you are lactose intolerance and you're a non-vegetarian, you also have egg for protein and calcium requirement. Okay. Next, coming to eating disorders, adolescent girls are most commonly affected with eating disorders. because they are very concerned about their appearance, body shape, etc. And for boys it is more about their fitness and general well-being. So anorexia nervosa is a very it's a common most common eating disorder which we see among teenagers. Okay, so this is what the principle of anorexia nervosa looks like. That the teenager, the female teenager, it is common in males also, but females are most commonly attacked. So the teenager may think that even they are skeletal thin. Okay, they're very lean, you can see their bones through and through, prominent ribs, prominent bony prominence, everything is quite prominent. Okay, but still when they look at themselves in the image, when they look at their own weight, even they're weighing very less. Okay, even if they are weighing very less, but they think that they're quite fat. Okay, so that is anorexia nervosa. There is rapid weight loss, they will not eat food, and they are always keeping the tabs on calories. Okay, you give them any you just mention any food item to them, let's say idli or sambar or sandwich or something, just give them the name of any food item, they will tell you how much calories that particular food has. Okay, ingredient by ingredient they can tell you how much calorie this particular dish may have, because they have by hearted all the calories of most of the foods that is available in their cuisine. Okay, so that is anorexia nervosa. So they have a lot of hair on their skin. If you want to see the exact symptoms, how different type, even in anorexia nervosa, there are different types. Okay, if you want to indulge deeper into this particular eating disorder, you can see this movie called To the Bone. It's available on Netflix as well. So if you want to check this movie, To the Bone, I have mentioned in brackets. Okay, so please check that movie. It's about this eating disorder, not just anorexia nervosa, but also other eating disorders have also been shown in this particular movie. So you will get an in-depth reason to why these kids have such hairy, because the hair will grow on their skin and all on their arms and skin. They will have too much of hair. It's kind of the body's way of protecting itself from thermal loss. Okay, so you will see when you see this movie, you will identify what kind of different symptoms are, how, what are the thought process. Okay, why do they choose this to happen to themselves. Okay, and what is the relationship with food? They're always hungry, 24 hours a day they are always hungry, but they will not even have a single morsel of food. Okay, so that is anorexia nervosa. Then we have bulimia nervosa. It is binge eating disorder, also called as binge eating disorder. So they, what happens here is, in bulimia, they will eat a lot of food. Okay, a lot of food. They will eat too much of calories in one go. Okay, and then soon after having food, they will try to induce vomiting on themselves. Okay, they will vomit. They vomit out the food again. The same cycle will go. Once they have vomited out after a few hours, they will again go and binge eat. Then again they will cause self-induced vomiting. If it is not vomiting, they will use laxatives. Okay, so this is bulimia nervosa, binge eating disorder. Another form of bulimia. Okay, bulimia and binge eating is the same thing, but there is a binge eating, a separate name of a disorder is given. That is for this particular reason. Bulimia nervosa, people who are suffering from bulimia nervosa will not look extremely fat or obese. Okay, they look quite healthy. Okay, that's one difference between bulimia nervosa and binge eating disorder. In bulimia nervosa, the person looks quite healthy. Okay, very rarely they will look overweight or obese. But in binge eating, okay, just by looking at themselves, you will know they are suffering from an eating disorder, because they're extremely obese. Okay, they overeat while stressed. When they feel lonely, they will eat. Okay, and when they eat, it's not minor snacking. They eat large amount of calories in one go. And once they have done their overeating, and when they look at themselves, okay, what have I done? Within an hour, I have completed this entire large size pizza or something like that. And then they will have low self esteem, that why am I like this? Why is it this happening to me? Why can't I control myself? Okay, so that is the difference between binge eating and bulimia. In bulimia, most of the patients who suffer from bulimia nervosa, they look thin, not thin, they look healthy and lean, fit. but in binge eating, they look quite obese, okay, quite fat. That's the main difference. Then we have female athlete triad. Female athlete triad, I will explain in detail in the coming up slide. Then we have anemia, very common among females because there is menstrual loss. Along with that, anemia is most common in rural states, rural areas of India as compared to urban because um, in rural India, even today, there is a certain mentality that the boys and the men of the house has to be fed better and more as compared to the females, the women or the girls. Okay, they have to compromise a lot on their basic nutrition as well. We'll discuss about this social cause later. Also, it is coming up as in another topic. Okay, the social nutrition issues in females. So anemia could be that particular reason also, and also that the females are not having food because of their body image. They skip their meals. And they are not able to replenish the iron that they have lost during menstruation. Okay, so that is the reason why anemia is common among adolescents. Then undernutrition, same because of certain social and cultural norms, teenagers do not have enough to eat, and even if the household can make good amount of food, they do not like home cooked food. Okay, and junk food will not give them enough nutrient. Okay, so they will have some micro deficiencies or major deficiency. Along with that, they may suffer from malnourishment. Okay, so that is under nutrition issue. Female athlete triad is coming up. I'll explain that later. Then we have premenstrual syndrome. Usually we call it as PMS. So again, it's a hormonal imbalance. So any teenager who is suffering from severe premenstrual syndrome, any teenager who are suffering from severe, a slight amount of PMSing is okay. Okay, slight amount of mood swings just before you get the periods and all, that is completely fine. Okay, but severe mood swings, lashing out, breaking things, okay, crying and immediately feeling happy, feeling depressed for a few minutes and completely lively within the next few minutes. So this is severe cases of PMS. Okay, unnecessary fights in the family and all. This is severe cases of PMS. So people who are suffering from PMS, not just adolescents, for female, other adult females as well. So make sure you take you check your intake of omega-3 and omega-6 fatty acid. Okay, if you take enough amount of essential fatty acid, it can help you with your PMS because uh, essential fatty acids can regulate your hormones. Whatever hormones the body is not producing enough, okay, that could be regulated. That produce can be regulated. If it is hyper produced or hypo produced, whatever is the issue, it can be regulated with just by correcting your omega-3 and omega-6 fatty acid. Okay, so with that nutritional correction, your PMS can also be become laid back. Okay, then malnutrition, same in rural India, it is very common. Malnutrition among adolescents, not that common in urban India. Okay, so the reason being same, they drop out from their school, they may have to help in farmlands or help their parents in daily wage, and whatever they are bringing to the household is not enough for the family itself, so they may cut off their calories. Okay, and usually in this particular age, they naturally have high energy, but they have very less food requirements. Okay, they think that they can thrive for a pretty long time on little bit amount of water and just a little bit amount of food. Okay, they can go a very long way. So that's just the age speaking, but after a particular age, everything comes down. Okay, so that could be a reason why malnutrition is this prevalent in teenagers. To correct PMS, please make sure you make sure you check your intake of omega-3 as well as omega-6 fatty acids. Vegetarian source of omega-3 fatty acid, omega-3 is flaxseed. Okay, non-vegetarian sources, it is your cod liver oil, fish liver oil, any fatty fish. Okay, nuts, seeds, All form of nuts and seeds are good source of omega-3 and omega-6 fatty acid. So just correct your intake of omega-3 and omega-6 essential fatty acid. You can relieve yourself your premenstrual symptom. Okay. Now coming to female athlete triad. So this green triangle which you see on this right side, green triangle, okay, optimal energy availability means the child is having the whatever is their sedentary lifestyle or moderate or heavy exercise lifestyle, whatever is the lifestyle, based on the lifestyle, they're having optimal nutritional requirement met. So they have optimal energy. Okay, the calories are met, per day calories are met by their food. Okay, so what happens is that they have good bone health as well. Okay, because once the calories are met, it means that their micronutrients and macronutrients are also met. They have optimum bone health. And then eumenorrhea. Eumenorrhea means there is no issues in their menstrual cycle. They are having a healthy menstrual cycle. Okay, so this green triangle means that everything is all right with this particular teenager or female. Okay, so what female athlete triad is very common among people who females who are in sports. Okay, reason being, what they do is what their way of thinking is that if I cut down my calories and I train hard, okay, if I can spend 2 to 3 hours on training, but I cut down my calorie, I can become calorie deficient and I can lose a lot of weight and I can gain a lot of muscle strength. But what happens is that if you continue this behavior pattern, it will lead to infertility. Okay, why it leads to infertility? It is because of this triad that happens here, the red triangle. Okay, when you cut down your calories, you do not have enough energy. There is low energy available. Okay, and this low energy availability could be with an eating disorder or without an eating disorder. It's not compulsory that if you are calorie deficient, if you are putting yourself into a calorie deficient state, it's not compulsory that you are suffering from an eating disorder. Even without any eating disorder, you can purposefully put yourself in a calorie deficient state. Okay, so one main factor is low energy availability. Second is, since you are not supplying enough nutrients to your body, your bone health will deteriorate. Okay, you will start having early signs and symptoms of osteoporosis, softening of your bone. Okay, bones become porous because bones already have calcium. Your body requires calcium. If you're not giving calcium and phosphorus to your body via your food, your body will eat up your own bones and bones will become brittle. Okay, easy, it will become porous. That is osteoporosis. And then since you again, the same reason of not giving enough nutrients to your body, there are no essential fatty acids, there are no fat in your body, no protein in your body to make hormones. Okay, so because of this reason, you will have, if there is no hormones, what will happen to a female's body? There will be absence of menstruation. So amenorrhea means absence of menstruation. So this is the female athlete triad. Okay, this is the healthy triad and this is the female athlete triad. Okay, so just by cutting down your calories, just by not giving yourself enough nutrient, okay, nutritional, you're not meeting a nutritional requirement, these are all the issues that you may face. This is the end game. Okay, the red triangle that you see. Okay, mostly only very few cases you can revert back into a healthy lifestyle. In other cases, once the female athlete has lost her follicles for because of prolonged absence of menstruation, she may lose her follicles. She may be infertile for her lifetime. Okay, so this is the female athlete triad. So is it clear to all what is female athlete triad? Just by cutting down your calories, just by not replenishing yourself with good food or nutrient, what are the dangers of, what are the clinical dangers that a female can face? Okay, so now next coming to the nutritional programs. So we have the World Bank assisted ICDS, integrated child development services or schemes. Okay, ICDS project also takes cares of a lot of female as well as adolescents and child's, okay, healthcare and nutritional sponsorships are taken care by the Integrated Child Development Program. Okay, they spend a lot of money in developing countries just to uplift the health of, especially their focus is mostly on rural India as compared to urban India. Okay, so the ICDS project has helped India in a long way. Okay, just to overcome lot of nutritional deficiencies, night blindness. Okay, vitamin D deficiency, other nutritional deficiencies, etc. ICDS program has helped us a lot to overcome majority of our food-based disorders. Okay, so their main money comes from World Bank. ICDS project is a branch of the World Bank's program for international health. Yeah, female athlete triad is only for females. Okay, male athletes do not have much of the hormonal issues based on calorie deficiency. That they may also have infertility issues, but that could be just because if their testosterone comes down. Okay, if they have enough fat cells, it will not affect the male fertility. Then we have supplementary food, that is 1,000 grams of food is given to females. Okay, it's a take home ration. If they come to school, every female child is given 100 grams of pulses, cereals, etc. As a mix, it is given to them. They can take that ration home. They can cook it. Okay, so the reason being that in rural India, as I mentioned earlier, the families do not focus more on the girls' nutrition. Okay, they think that it is a burden to feed a child. Okay, so what the government has come up with is that we will feed, if she is a burden to the family, don't worry about it, we can take that burden. Okay, we can pay for the child's food. Okay, we can give the child food. So 100 grams of food at least, that's what the government is can afford to do right now. So that is the take home ration. If the child is coming to school, she can go back home with 100 grams of food per day. Then under the Rajiv Gandhi Scheme of Empowerment of Adolescent Girls, that is the RGCA, that is a Sabla Nari scheme. Again, in this, there are high chances that adolescent females are dropping out from school at a very early age. Usually, as soon as they hit their menstrual age, they drop out from the school. So life skills, major life skills are taught to these girls, like sewing, okay, or public speaking, or some life skills that they can put into income generating also, like some hand work, some embroidery work, or something like that. Okay, so these skills will teach them even if they choose to drop out from the school, but they have a skill at their own hand to empower themselves later. Okay, to start their own business, to start any entrepreneurial activities, etc. So that is a Sabla scheme. Then we have Chennai Corporation Scheme. So 60 grams of biscuits is given to the students who are studying in 10th and 12th during their extra classes, because in 10th and 12th we have board exams. There are high chances that most of the schools will keep extra classes. So if the children are hungry, if they're staying back at the school, not going home, obviously they're missing they're delaying their lunch, right? So to make sure that the kids are attentive, okay, they listen to the special classes, they make use of the special classes, they're given 60 grams of biscuits. So if the 60 grams of biscuits can give them that quick carbohydrate load, and because of that they will not lose their focus while studying in the special classes. So that is the Chennai Corporation Scheme. Any doubts here, please mention in the chat box.